Everyone, happy Friday. So I'd like to talk about the chapters for this week. Chapter 10 talked about general anesthesia used in dentistry. A key takeaway that I got from this chapter was how studies on nitrous oxide, if and when used long-term exposures occurs over time in a dental operatory can have adverse effects on the dental personnel, especially females. Incidences revealed that women dentists and hygienists reported having spontaneous miscarriages. This raises awareness and should remind all dental personnel to double check that there is a good ventilation in the operatory and that the scavenger system is working properly. In relation to nitrous oxide and its relaxing effects, Chapter 11 discusses about patient relaxation in dentistry with the use of anti-anxiety agents. This chapter starts off talking about the popular drug used in dentistry called benzodiazepines. What I didn't know about benzodiazepines is that it can also be used as anti-seizure medication. I also did not know that long-term use of the drug can have some side effects, such as disruptive sleep, muscle fatigue, and cause other effects like nightmares. This is also known as CNS depression. Like CNS depression, there are many drugs that can affect the mental activity, stated in chapter 15. Not only anti-anxiety drugs, but there's drugs used for psychiatric care such as schizophrenia, bipolar disorders, obsessive compulsive disorders, and depression. But like I mentioned about benzodiazepines, first generation antipsychotics can interact with drug and increase CNS depression, causing full sedation, cognitive impairment, and respiratory depression. In clinic, I actually experienced an interaction with a patient who was diagnosed bipolar schizophrenia. Although I treat all my patients with empathy and care, I knew right away during the first impression that this patient was going to need extra care from me. For instance, he reported to me right away that he was cold and said to me, "Don't you have something you can give me? It's really cold." So, me being naive and extra that I am, I let him borrow a clinic coat, and I definitely got in big trouble by faculty and especially by Jesse for doing that, and I highly recommend not doing that. However, this patient was special, and I did not want to cause any alarm or create a situation that would agitate him, or create a situation where, well, just create a situation because sometimes their reactions or behaviors can be unpredictable. Yeah, so that's all for now. Thank you.